Welcome to Therapist Spotlight.
Hello, everybody, and welcome to Therapist Spotlight, the podcast where we aim to showcase our wonderful members to the wider community. I'm your host, Joshua Brooks, and today with us we have Craig Kelly. Craig is a clinical nutritionist, exercise scientist, owner of Fusion Fat Loss and Nutrition, and I believe an award winner as well. So this is going to be an amazing conversation. How are you today, Craig?
Awesome, Josh. Thanks for having me, mate. Much appreciated.
Our pleasure. Hey, so first question, what got you into natural therapies? What got you into natural health?
I guess, mate, it was just exercise was something I did. I was overweight as a youngster, like heavily overweight, and I guess ridiculed at school. And I went to a co-ed school, and it wasn't until I guess hormones kicked in that body image and I was called Jelly Belly Kelly, and I guess that resonates to today. You know, is that I was heavily overweight. I was a jock though. I could play sport. I think that was a godsend to me at that time. I wasn't just a Nigel nerd at the time. I'm more happy to go by the Nigel nerd now than I was a jock though. But being, I guess, good at sports, I was with the cool kids, so to speak, so it didn't sort of affect me too much. The bullying back then, I finished school in 87. So obviously today's world's a little bit different with social media, etc. But I started in the gym because my dad would pick me up every night and take me to the gym, and I fell in love with it. You know, the ability to morph mentally, physically, and emotionally with exercise, and the old silkworm to butterfly or Volkswagen to Porsche that was able to take place with training. But that was only part of it, you know. I fell in love with the training, but I was still eating McDonald's after training, and it's just become, as I got better and better with sport, that nutrition becomes something, and then that become my real passion. Now I train personally because I love it. Part of my business is obviously training people, but that's not the part I love. I just love what they get from the training. But nutrition is, you know, the governor for me for everything. Disease defying, feeling awesome mentally, physically, emotionally, all of those wonderful things that, you know, I guess a lot of the members understand themselves, and we're just trying to convey that message to everyone that we have ample opportunity to feel awesome if we can stick to a lifestyle path that is just that sustainable.
And so how does it look in your world when people come in? Do you give them exercise programs, nutrition programs, or do you sort of try and teach them how to eat? Do you have like boot camps? How does that look in your world? What do people get when they come through your door?
Yeah, so a bit of all of that, Josh, because pre-COVID, it was very different to what we are today. So we used to have large groups that were one of our products. We used to call it fire and ice. So fire was focused, intense resistance exercise, so lifting heavy stuff. And then ice was intense cardiovascular exercise, which was, you know, the social intervention of having a communal group that loved exercise, getting hot and sweaty, but it was over in 25, 30 minutes. And then you could have a coffee and a giggle and a cry or banter. And with the COVID requirements and the 4 meter per square, that changed that part of my business. And that basically become null and void, the boutique groupie stuff, and we went all one-on-one. So to this day, we still haven't returned back because we'd start and then it'd change, et cetera, et cetera. So we now operate at max in the exercise part, 3 to 4 people maximum. So we just call it boutique VIPU, which is typically groups of girls where probably 90, I think last statistic, we're about 95, 96% female dominant business. Wow. And the males that are in it tend to be the other half of, so the mums or the wives have come along and dragged their son or their husband or boyfriend or whatever and said, you need to come and do some of this too. And they've stuck around, which has been great. Awesome. But they often have dietetics. So, Transform You is a program that has weight training. So me and them resistance training, teaching them the importance of strength training and lifting stuff. And the dietetic component, so diet rehab. So there is no trend, fad, vogue, blah, blah, blah that goes with it. It is about just getting back to sensible eating. We give them a little bit of stuff on portion distortion, overeating, macronutrient stuff via hands. We don't use calorie counting and that because of my history with eating disorders, etc. So I just find that people respond better with it, not counting calories and measuring, etc., because it's just another reason where it gets a bit hard. I'm not saying by all means, Josh, that doesn't work for other people, but my business, we sell my products based on, look, there's none of that stuff. If you want that, I can definitely refer you on to someone who will be a little more analytical in approach. But I've just found with my history and my personality in particular that I'm on all or nothing. So if I had to rely on measuring things, counting things, it become excessive to the point it was dangerous, and so I just removed that stuff from my practice. We don't measure, weigh in people anymore unless it's a special request from them.
And I know from my own personal experience, like with a lot of my mates, when you are doing that calorie counting, that leads to a stress all on its own, I found. So it's like, you remove one stress and then you add a different stress and it's like, whoa, it just blows out of proportion sometimes, I think.
Oh, mate, you nailed it. And I think that's the thing we're trying to teach people about. Life's stressful as it is, isn't it? And then there's all these hard and fast rules. And if you can just say, look, we just want to eat a little bit better. We just want to move a little more with a bit more motivation and enthusiasm and something that you like. And if they're coming in here every week to catch up with me and I'm pulling out a scale and a measuring tape, elevated cortisol, you can just see it. It's almost like, it's bubbling out of their adrenals, that you just go, oh, no, why did I put them under that environment? They're trying to find something that they can sustain. And this is one reason why I can pull the handbrake on and prevent them from doing that. So, yeah, it's just something that worked for me personally, and I guess my business has evolved. It's been evolution, Craig, where I've become less and less and less analytical. But then I get into this sort of conversation with colleagues, but then how do you track and how do you assess? And I said it's just verbal conversation. How are you feeling? Are you sleeping better? Are you stressing less? Are you moving more? Are you enjoying training? And then it's hallelujah moments like that where I go, mate, we're winning. And when I say we're winning, it is a purely collaborative approach, my business. But I have changed. Josh, if you met me back in 88 through late 90s, early 2000s when I was a competitive bodybuilder, mate, it was all about tight bonds, T-shirts, veins popping out, broccoli, cauliflower, bench press and burpees, and it was my way or the highway. Just naive practitioner that just thought everyone wanted to look like I did. So they had to do what I did, and absolutely it was just, again, that evolution through the social sciences. There was a lot of reading and understanding about mind massage, we call it in our practice, which is that whole psychology and counseling and, ACT therapy. They made a huge difference in regards to how I functioned as an individual one and then as a practitioner and collaborator too, and I found that's been able to give me longevity in this health industry. And I guess I'm assuming a little bit different to a lot in that I'm not a naturopath or a aromatherapist or et cetera per se. I have that exercise component first and then moved into the clinical nutrition part.
Yeah, definitely. But I mean, again, the exercise is so important. And when you can marry those two together, I think it just takes you from, one level to the next, right? Because like you said, especially because we live in more sedentary lifestyles, having that ability to teach them how to move properly, I think is just a game changer.
Yeah. And as you'd be well aware that, we're finding with nearly every sort of therapy treatment to disease that exercise is mentioned, whether it be cognitive, whether it be, physicality, whether it be emotionally, and COVID's been a perfect example, hasn't it? With all the government authorities, et cetera, and medical authorities saying, get out and exercise. That's been one of the characteristics where we could get a tick the box to leave the house and to do some exercise for that, trying to prevent the hideous effects that these thoughts can have on us, and that's where that whole eating disorder thing for me when I was in my early 20s really got a hold of me, where your thoughts just grew fangs and teeth and were nasty, red, inflamed beasts, and you found yourself, suicidal and all of these things. It was a horrible environment to be in. It's funny because it's a paradigm shift or a toss of the coin, where I love the whole process of food and what it can do for you, but that whole food enigma at the time, that diet conundrum, allowed me to, nearly put a nail in the coffin, because
sure.
Yeah, so it was an interesting journey, that part, but one I would never, ever, ever, ever change, because you can empathize and sympathize with people, I find, a lot more than just coming from that, what do they call it? Ivory tower.
Yeah, definitely. I guess I got two questions for you that's burning. So one, what I hear a lot of is and I think you're in a perfectly unique situation for this, right? So like when you're talking to a lot of women, I sometimes get the comment that like, I don't want to lift weights because it'll make me manly, or I don't want to lift weights because it'll make me buff or something like that. So I'd just like you to talk to that, since you do have, like you said, 90% women through your training. I think weightlifting is so important for everybody, but yeah, could you just talk to that a little bit for maybe some people who are on the fence?
Yes, absolutely, 100%. You're right. It's something that you do have when people initially make contact with you, and they are, we use that term deconditioned. We don't like using other, words, but they know they're deconditioned. They just don't feel the way they are. And then you talk about the benefits of strength training, and I think it's play on words when you go, okay, to be strong, enables you to do the things you want, when you want, for as long as you want, not being driven by a disease. So you talk about the benefits of that rather than, changing shape. And then you talk about, do you know how hard it is? It is one of the hardest things to do, to actually build lean muscle tissue, and you're worrying about, bulking up. Talk to a male that's trying to, and if they were magically able to just click their fingers and lift a couple of things heavy, and they just morphed into this monster. And we're in that environment typically where we are testosterone rich, a male, that we, can morph a little bit more. And it's just enabling or accepting that their fears, and then allowing those fears to be listened to, but then giving them all of this magic that comes from strength training, the fountain of youth. It allows, all of these things, defying blood glucose elevation, strong bones, tendon and ligament strength. And we use the term panel beater because this is it. Because the only way you can change your physical shape, is by, getting out the chisel and shaping these things. Strength training does that. Aerobic activity doesn't have the same effect in regards to looking differently. So as obviously strength training can. And what they start to buy into that over time because of trust, and they, I practice what I preach. I train every day of the week. I enjoy it for what it is. And then you I guess, enable them the ability to govern their own journey. They're in their rowing boat. They've set their coordinates. And when they fall or stumble or take a wrong turn, you just sort of guide them back to where they're coming from. You put little targets out there and say, so look how much now you're deadlifting this weight. When we started, we were doing this. This is why you're so strong. Now, this is why you're charging up the stairs with your grocery bags hanging off, and you don't need the husband or the kids anymore to do it. So you're trying to allow them the opportunity to see where this fits into their life and their physical improvements. And then with that, over time, comes the love of lifting stuff. And it just tends to be social media now. There's lots of women, young, older, and different, that are just wonderful, role models, because there's so much ladies involved in strength training now at some level that are no longer about being, skinny and petite. They're about being strong and powerful, women. And that's wonderful. It makes my job that little bit easier.
Yeah, definitely. And I love what you said. So you're preaching to the choir with me, because strength training is something that's just like ingrained in me. I love it more than anything. But I love it when you how you explained it, right? Like when you focus on function, your form naturally develops to propel that function. So yeah, I think that's one of the biggest things that we've got to educate people on. It's like, well, if you're training to get big, then you will get big. But if you're training to be functional, if you're training to be strong, well, you won't necessarily get big. Your body will morph into how that looks for you to be strong and functional.
Sure. Yeah, because you can get right up into the science of this, rep ranges, muscle hypertrophy, strength training, power training. And then, where we train a lot of the women in particular, strength endurance. So they get, there's a whole plethora of rep ranges. They might work at 1 to 6 for a little while. So they, really tapping into those fast twitch fibers that are, prevent things like falls prevention and those, because they have got those muscle fibers firing rapidly. But you don't spend forever there, so that if they have that genetic predisposition to, lay down slabs of muscle fiber, that they don't turn into the She-Hulk. So then you give them the ability to spend time between 6 and 12, where that's really the sweet point for most of us, where you're getting really good strength, but you're still at that sort of zone where that, lovely silkworm, the butterfly starts to form. And then you give them that sort of 15 to 30 plus, where that's the acid bath. That's where some of these women, they're so strong and they challenge themselves. Where they're in this acid bath, and most of us guys are tapping out, saying, oh, no, I can't do anymore. And they're grunting away. And this is where they get that real aerobic conditioning as well, and then so that, in the pseudo bro sciencey terms, you talk about where they get, that really lean look in the muscle, where it doesn't happen in science, but it's the language that's used in social media and some of that bro science. So it's really using that whole conundrum of the science that we have in regards to slow twitch, fast twitch, not muscle fiber activation, that we use that recipe, but we don't use those big, gluconeogenesis and la terms. We just use stuff that goes, do you want to muscles look like this and lean and blah, blah, blah. Yep. Okay, let's do that. So you're giving this whole thing where they're buying into the approach and they're going, are we doing that, that one where I really have to grunt today? Do you feel like doing that today? Yeah, I've had a bad weekend. I need to get some of that out. And I'm going, geez, I'm glad I'm not like them, because I can lift that heavy stuff because it's so much easier. It doesn't hurt as much.
That's it.
But that's, it's trying to give them the best of everything, and tailored to them, of course, absolutely tailored to them, as unique as they are.
Yeah, and I think that's so important what you said too, right? It's like, I think as therapists, sometimes we want to impart so much knowledge and science, and again, sort of to make us look legit, maybe some people, but it's like, what's going to land for your client? What's going to make them engaged, and what's going to make them learn? And so using the language, meeting them where they're at, and able to impart your knowledge so that they can actually get really good results and can actually take that forward in their education, I think is so important.
Yeah, true. So true, mate. Yeah, and again, that's an evolution of me, because there's no doubt in the world, mate, at some stage, being geeky and using all the scientific terms, and if you looked hard enough, you'd see him just gloss over and go, I've got no idea what this dude's talking about. Yeah, so there's very little of that now, Yeah. Absolutely.
And so what I'd also like to ask you is, again, diet is such a red hot topic at the moment, right? Like you got keto diet, you got vegetarian, you got plant-based, you got everything that they just throw at you.
Yeah.
How do you approach that with your lifting and trying to, mold it into a more sustainable diet, maybe? Like, how do you get around people's ethical or maybe even just preconceived notions, or they've watched a documentary? How do you get around that with your practice?
Geez, it's hard. It's hard. It is. Yeah. And I'm not going to lie to you. That's the one area that I still struggle today. And there's many of these moments, and I'm not real good at it, where they'll be chatting and I'll go, oh, please. And literally in front of them. So you've seen Game Changers, or you've seen this, or you've seen that. And look, I just turn to them and say, you know what? I'm so enthused that you're investing time into your health. It's wonderful. Absolutely. But my question is always going to be this. Can you sustain what you're doing, And Josh, the funny thing about this, and you're going to know this as much as our other practitioners and friends out there, is that they're not silly, the people. When they pick up the phone or come through our door, they know exactly what they need to do. They haven't come down from Mars. They understand we need to be eating more fruit, vegetables, nuts, seeds, grains, unprocessed foods. We understand that. They understand that. Typically, the hardest thing about what my job involves is allowing them opportunity to apply the information, because that's where they fall off. Oh, Craig, I put a salad together and but I'm time poor and I'm this and I'm that. I'm not a 3-star Michelin chef. And they're all real reasons, why. But so I try and remove labels and pigeonholes, whether they are keto or whether they are zone or whether they are, like you said, vegan or vegetarian or whatever. If that's the way they operate and their diet is what we would use as healthy, there's variety, there's diversity, they're not fastidious about, whether they've had 125 grams or 132 grams, if that's the way they're operating, I'm just going to say, wow, I just want to make sure you've got that color, effervescence, variety, and lack of HI, as little human interference as possible. Yeah. Regularly, but not all the time. It's removing one specific word that was nearly the death of me, perfectionism traits. That's it. But if I have this, Craig, I've ruined my day. And then I get forward and I go, why? What? How? Let me know why you feel that way. Well, Craig, I had this, and this, and the diet said I needed to do this. And this is when I go, but you're governing this. Like you don't need to be so tightly regulated. Oh, hey, Bodes. Tightly regulated, unless you choose to allow that to happen, And that's the hardest part of this, and that's often the area that you're reevaluating and consistently negotiating with your client base and patients in particular, especially patients if they're medical patients, stage 4 pancreatic cancer patients, etc. Because they've got all these other things going on as well with treatments, etc. But the just transformation people, so typically healthy, just, trying to form lifestyle habits, it's trying to remove those labels unless there's a medical reason. So if someone's keto because of, epilepsy, okay, well, it's it's a prescription that we might use for 8 to 10 weeks. But even then, after that, we try and get into a more sustainable, balanced approach where they wouldn't just be typically keto, less than 50 grams of carbohydrate a day. We'd move dietetically into, 100, 150 grams of carbohydrate a day and assess their cognitive clarity and whether the pharmaceuticals that they're using to manage, grand mal, etc., are still working effectively. So it's different for different people, but, we would tend to be a non-diet practice unless for medical reasons. For everyone else, over time, you try and allow them to evolve their own eating regime based on, lack of HI, lots of diversity and variety. There's a guy moons ago, Dr. John DeKell, and I loved his philosophy on diet, and I've used it for many, many years. So he had something called the Rule of 15. So this was his rules of diet. So the Rule of 15, minimum of 15 different foods a day, a reduced HI, human interference, and there was 2 food groups, basic and bonus. Basic was anything that was fruit, plants, vegetables, lean proteins, and bonus was anything else. And that's how simple diet became, and I love that because it just allowed sensible eating, learning to understand that we didn't have to be eating all the time if we weren't, if we had to eat 6 times a day because someone had told us you need to eat every 2 or 3 hours, but you felt bloated or, what have you. You didn't have to do that. You had to listen to the greatest machine ever built, and if you weren't hungry, don't eat, because you didn't need the obviously energy content because your body was happy to function the way it was. And I guess it's getting back to that, Josh, just allowing the person that's sitting in the chair opposite me in my practice to know they are the governor of their success path, and my job is just to pat them on the back or, if they drop the ball, pick it up and pass it back to them and say, we got this. Yeah.
And so with your nutritional qualifications and your training, do you do much supplementation? Do you sort of look at bloods and see if they need any trace minerals, nutraceuticals? How does that work with you and your practice?
We have used in the past, and I've even used things like microbia with University of Queensland with fecal, assessing, etc. So with patients, maybe, and again, it's typically not at the start because some of the guys, if I've been chatting and they've rang up and said, Craig, I'd like to make contact and I'm having a phone conversation and they've got medical issues, I'll say, have you got lots of data for me to look at and analyze, meaning bloods, etc., etc. Have you had a fecal assessment? And a lot of them may have had a lot of stuff before they get to me. So then I'll review some of that stuff. And if there's a hole missing or a bit that I think that's missing that I haven't got a test for, I might send off, and get some bloods done or something done, some sort of pathology. But typically I like to work with them for a while first and then see, unless there is something that's just in the back of my mind, something doesn't feel right, and then I'll get that done straight away. In regards to, again, a non-ill patient and just someone who's trying to change again, very, very rarely would I use any of that stuff. Sports supplementation maybe come down the line in regards to if they're not meeting their protein requirements, because for some people meeting their protein requirements as they advance, when we're operating between where the science currently sits in regards to 1.6 to 2.2 grams of protein per kilogram of body weight for lean muscle mass gain. A lot of people wouldn't be eating that amount of protein. So then supplementation might come in to the equation because they physically can't eat that amount of food. So again, very dependent. I'm not against any of that stuff, far from it. I'm very much about that, and as I said, I've done microbia myself and I really enjoyed the experience. But I try and allow my own picture to form over time. And if people start to say they're sleeping better and they're, mentally haven't got the cotton wool mind anymore and they're enjoying their training, in conversation, they're not complaining about aches and pains or anymore. Well, I think we're making inroads. And as most of us would know, again, it's not the morphing on the external aspect is always the last thing to change. It's all the magic that's going on beside that. You can't stick your head inside yourself and go, look at that cell, look at that, look at how it's replicating. It's doing itself magically. You just don't see that. You feel that, but you don't know that's what's going on. You can say, but I want to fit into the size 8 white bikini, Craig. It's coming, but just give it some time,
That's right.
We've got, like a lot of the practitioners would have, accounts with, nutraceutical companies, and we use them absolutely when necessary because, as with everything, they're a supplement, as you said, Josh. They have their place.
And I guess it's also a nice way of teaching people how to become more body aware and more taking control of their health and empowering their health rather than being numbers on the page of, okay, you're within this range. It's like, well, how do you feel? How do you do? And it allows them to get in touch with themselves and take it forward. Just as the last question, we're coming up to time, unfortunately. This has been absolutely amazing. But one, where can people find you? Where's your clinic? Where's your training facility? And two, what kind of people are you looking for to come to your training? Are you specifically just looking for everyday people, or are you athletes, or what's your sort of clientele are you looking for?
Yeah, mate. So we're in North Lakes in Brisbane, so our practice, and the whole practice runs from here. We have a room set up at the front for interviewing and, medical stuff, and then, the panel beaters in another part of the facility. So, so we're all and sundry here in North Lakes. Joe and Betty Bag of Donuts, mate, the layman. We've worked with Taylor McEwen, an Olympic swimmer, and her sister's at the Olympics right now, Kaylee. So we've worked with the elitist athletes, etc. And look, anyone who wants to walk through the door who thinks we could make some difference, that's who we're looking for. And I guess one other part that aren't looking for miracles, because they're their own miracle. We don't do the magic for them, as with all practitioners, I'm sure, whether they're remedial therapists or not. We stimulate the body to do its magic. None of us are gods, and that's the part I love about it, where I just say, look, mate, I'm a human like yourself. I make the same mistakes, but there's tomorrow and our next meal and our next session. So that's us in a nutshell, mate. Just little old me and a dream that turned into, being able to work for yourself and make a career out of it, I guess.
Yeah, it sounds wonderful. Well, guys, as always, the links will be down the bottom, so just click on through. And please, anyone out there in Brisbane, contact Craig if you want some really good training by the sounds of it, and some awesome nutritional advice, and just get onto it. But yeah, Craig, thanks so much for coming on. It's been absolutely wonderful. We really appreciate it.
Josh, thanks for having me, mate. It was a pleasure.
All right, and for everybody else out there, have a great day, and we'll catch us all next time. See ya.
Thank you for listening to Therapist Spotlight. If you would like to know more about ANTA, visit us at www.anta.com. anta.com.au.